So I'm concerned about the patient who had a fall or who is likely to have a fall. And now what test that I would like to do is get up and go test. So for this get up and go test, I'll ask the patient to demonstrating now. So Assalamu alaikum, my name is Dr. Kashan. Today I'm going to examine for you for a test. Alright, can you get up and walk 10 feet and then return back. Consider that is 10 feet, alright, and then we come back and then please sit down. Okay, so now the patient is, and I need to time this. I'm timing it. Okay, it takes 6 minutes or 8 seconds actually, 6 to 8 seconds for him to get up, go, and then come back. So what observations that you guys have done?
This is normal because it's less than 10.
It is normal because it is less than 10. So one is the time that you are concerned about, right? Number one. What else? What were your the observations? Gait. While he was walking, he's walking normally. What kind of gait you can observe?
Maybe waddling gait, maybe a Parkinsonian gait,
So shuffling gait or wandering gait, or this is called
waddling.
This is circumflexion. Yes, and this is intelligent.
Soldier marching.
Soldier marching. Yes, the females. Yes, from the females. Yes. What you guys were saying? Female. Okay. Yes. All right. So now you're observing the gait. Once you stand up and then he's going down, going from here. So you're observing the gait. Okay. Then he turned around. He's coming back. So you are again observing the gait. When he's turning around, he may have some kind of vertigo. So at that time, you also need to be very careful whether the patient is unstable or stable. That's the thing. Yes, there was some noise from the female side. Okay. Yes, Asad.
Also when he stands up, we check for orthostatic hypotension.
Okay. So if there is orthostatic hypertension, then what kind of response you may get?
He will have maybe blackout in the eye. Maybe he will hold the chair. He will wait a little bit until he regains vision.
Maybe he may have blackouts. He may be unstable because of the orthostatic hypotension. And the second thing is actually not because of the orthostatic hypertension, but because of some kind of osteoarthritis in the knees. He may use his side to stand up. So that could also give you some kind of clue that the patient has some kind of needs some kind of assistance, or there is some kind of discomfort present. So the patient using any support system while he's walking, while he's standing and sitting? If there is possibility of orthostatic hypotension, then he may have some kind of unsteadiness while he stands up. While he's walking, he should also be stable. That signifies that there are no orthostatic hypotension, there is no dizziness, there is no vertigo. And when he's also turning the back and then coming again, you are observing all the things second time, and you also time the whole process so that you know that okay, now this patient is safe. So this is how we are going to screen the geriatric population before it happens. We usually don't do after fall. Ideally what we need to do is we need to screen before it happens, because if there is some problem, what my objective is to stratify all these issues that I may observe. When you go into your primary healthcare center, please do only this one test, and then you can have multiple observations. On that you can recommend the caregiver or the patient that this needs rectification. Yes.
You said we have to observe for the vertigo if he is taking a turn. So while he is walking, we have to hold him from the side, or we have to, because he may fall due to vertigo.
He may fall due to vertigo. So that depends on how unstable the patient is. Okay. If you think that the patient is already moving and is already swaying, so obviously you need to have some support, some kind of support. And if you think that the patient is already on a support of a stick, this patient particularly is not a good candidate to have a screening, because in that you probably would not require a screening. You already know that he's already on the taking some devices to do. For those patients who are not using these devices and you're not really sure, you need to do get up and group test to stratify the risk of developing